My take on it is kind of like very similar to our discussion earlier about experiencing negative emotion. It is not helpful to avoid negative emotion. It is also not helpful to get lost in your negative emotions, right? Because if you avoid negative emotions, you're not paying attention to an important part of your experience. If you get lost in a negative emotion, then you're, first of all, experiencing distress, and second of all, probably having some sort of functional interference in your life, right? So it's very delicate, and there's a balance between acknowledging something, right, and getting lost in it. Similarly, when it relates to shows like that, or pretty much anything that's in the news media, yes, it is great to bring awareness and knowledge about a particular topic, especially something as difficult as suicide. On the other hand, we also want to stay away from getting lost in these ideas, because it creates a behavioral precedent for people to continuously do it, right? So as you could tell, it's a delicate balance between ignoring it and also almost like promoting it as an option. So our job, and I would encourage anybody, when you bring an awareness, right, the idea is you bring awareness and you present options to change. To me, that is the most effective way to bring light to a situation and also propose ways out of it. Just ignoring it altogether is not functional or helpful, but also spending too much time on the problem and what the issues are. Also, you're getting lost in the problem itself. So the problem becomes bigger and bigger and bigger by just focusing on the problem, right? So this is where this delicate balance comes in. So shows like this, again, if it brings real light to the situation, that's a great idea. But again, if the show just focuses exclusively on the issues and the problems and the reasons why the person doesn't want to, continue their life, and unfortunately have made a very difficult decision and were driven to it, if you will, I'm not really sure how effective it is to actually help others stay away from acting in this way. It's a delicate balance of acceptance of how you feel and at the same time making a commitment and a dedication to change, right? That's the delicate balance. If you're spending too much time in the negative emotions, you're in distress and likely to have some sort of interference in your life, right? So this is, to me, very similar. You spend too much time seeing what the problem is, what the negatives are, right? You're not really allowing for the possibility or the focus on what actually will get you out of trouble, right? So the more shows are just like that and focusing on the problem, my concern is exactly that. People will have that as an option because they've seen it. When we lose the focus from identifying a problem and coming up with solutions and just focusing on the problem and what the issues are. Again, as a clinician, definitely not helpful. But Hollywood does a lot of different things that from a clinical point of view may not be very helpful. But there is a reflection on how some people struggle, and potentially this show is a reflection of that. So there's some helpful aspects to it to bring awareness. My concern is, again, getting lost in it and showing that as an option, romanticizing it in general, glorifying it, which is all unhelpful things, especially when I work with individuals who are potentially depressed, potentially suicidal, and are watching shows like that are not, it is not very helpful to their overall mental health. Hi, Dr. Lukin here. Thanks so much for tuning in. If you like what you're seeing, feel free to like it and subscribe down here. Thanks so much. Bye.